Thank you guys very much for being on the call today. It's another fabulous Monday morning here, and it is Monday, August 29th, 9:02 a.m. Really appreciate everyone taking the time this morning to be on the call. We do have a special guest this morning, Mr. Rick Krug from CleverRx, and he's going to talk to you about some of the great things that they have rolled out this year, and an update for those of you that are participating in the program. And if not, great opportunity to do so because we are getting ready to roll into AEP. You want to be able to have, many solutions for your clients, and this may be one of them. So there it is. So with that, we are here to improve the lives of our community with affordable health care. So I appreciate everyone being on the call and upgrading your mind so we can go out there and help our community get the best care that they can. So only way to do that is knowing what we're talking about. So we've got some training and some webinars this week that I want to ensure that everyone is aware of. So I'm going to go ahead and share my screen here. And this is our training calendar. Again, if you don't know or you don't have this hooked up into your phone, laptop, or tablet, whatever you're using, please make sure that you reach out to somebody at HPM and we can get you the calendar. It does also live on the Gold Key as well. And just so you know how to get to it, let me show you exactly what to do. So you all have the Gold Key link, hopefully, and you click that. You go into the Gold Key here, and it would be under your training, under activities, training, and HPM training calendar is right here. So there it is. You can get to it quickly, but if you want to load it as a normal calendar in your phone, so it looks like all the other events, just reach out to a team member at HPM and we'll get you set up and rolling on that. But in the meantime, this morning, CarePlus is doing a sneak peek on their benefits for 2023. So that started at 9. Sorry, I'm disrupting you from that. I'm sure there's going to be some other ones as well, and it will be pre-recorded. So make sure to reach back on that one. Nothing going on Tuesday. Wednesday this week, Emblem Health is doing their planned webinar. That's Emblem up in Connecticut area. If you are contracted in Connecticut, you do have an Emblem training there at 10 o'clock if you're interested. Jumping over to the 1st, scary, September 1st is already here this week on Thursday. Devoted's doing a coffee and chat session. That's at 11:30. You can jump in there and learn all things Devoted. Just remember that the month ends on Wednesday this week, so make sure you follow up with all your loose leads that are out there, clients, and get a good finish there on Wednesday. Remember, completing an online application even at midnight, you'll get your member effective the 1st. Okay, that's why we don't want to do paper apps, because it delays the process. So using HPM Shop, which will now be called Medicare Shop, you can do your applications all the way up until midnight on the 31st, and it will still be effective on the 1st. So just remember, that's what we want to learn here. And then on Friday, really, really, really important training, the new rules for CMS call recording. I am hosting it. It will be at 9:30 on Friday. I have sent you guys some emails and text messages about this training. Please make sure you go on the calendar and register for that. This is a big one. Yes, I am going to be recording it, but I want to be able to answer any questions that you have. So this is a live training, 9:30 on Friday. Please be there. We're going to have the chat set up, and so just bring your A game there. Make sure you're on a computer. It will be a lot better because I have a lot to show you on that. If you're calling into the webinar, you're not going to get a great experience on this. So 9:30 Friday, please jump into that, and we will be really happy to see you there. Also on Friday at 10 o'clock, WellCare's doing their first look, and that one is in English. They're also doing another one there on Friday at 2 o'clock in Spanish. So if you prefer en español, there you go. So it's a light week this week as far as training. You still have these first looks coming, these rollout sessions coming, and really you need to fill your week with doing your certifications, okay? Many of you have not completed your certifications or got those done. Please take time to do that, get those out of the way. You're almost a month away from October 1 here, so it's time to get busy. Right now, starting on Thursday, you should be locking in your appointments for October and possibly even November. So all those people that you talk to all year at your tabletops, uh, the leads that you've collected, all those people that you got consent to contact in the fall. This is the time to get organized and get that going. And we're going to talk about the campaigns here. Okay, but the first thing is like I just said a moment ago, please make sure that you get your certifications done, your AHIP. If you haven't done your AHIP yet, uh, please do. It's about 4 hours long. It's a big one, right? And then you've got your training sessions there. So please make sure you get all that done. I will have a call recording solution that I'll be talking about on Friday in detail. But if you want to do some preliminary research on that, we are using RingCentral, and that is the one that we're going to recommend for everybody. Again, I'm going to have more details on Friday at 9:30 during our webinar, and I'll tell you how to use it and what we do and all the great benefits that it has with it, not just the call recording capability. So tune in on Friday at 9:30. Really appreciate that. Okay. So just as I was saying before, it's time to get ready for AEP. And now we have a new partner to help us with our AEP campaigns, and that is Spark Advisors. Many of you have already been introduced to them. We've been talking about their CRM system, their incredible member services department, and the tech that they have. But they've also been able to launch and give you guys some great tools. And one of the biggest tools that I think is going to move the needle for you this year is their AEP 2022 Guide to Member Services. Okay, this is their AEP campaign, and I'm going to go high level on this because John Mullen does a training for about an hour and 5 minutes, and it's pre-recorded, and I'm going to go ahead and launch it in the chat here for you right now. And so when you have time today, go out there, watch that webinar, and it talks about what Spark is going to do on your behalf. Okay, and this is from helping you upload your book of business to launching the postcard with a QR code to your members with your picture, your name, your phone number on it. And then it takes your member to a survey, and they can either call in to member services and do the survey, or they can do it online themselves. And during that survey, it's asking them that question: are you happy with your health plan? The answer is yes. Great. Nothing need to do. You'll get that report at the end of the campaign. If they're not happy, then it asks them a bunch of questions. What's wrong with your plan? Who's your doctors? Where's your medicines? Is this the right address? Is this the right phone number? We're missing your email. All of that is going to be cultivated, and it goes right back into your CRM automatically. So every time that we do a campaign to help you manage your book of business, it's going to be enriching the data in your CRM system. Okay. So if one of your members passes away, member services will get that note and clean up your CRM for you and leave notes and say, hey, this is what happened. We want to let you know. So it's like having a virtual assistant. And if you're not taking advantage of this, especially if you have a large book of business, you're really going to be missing the boat on this. I don't know how you're going to manage your AEP without an incredible department behind you. Those of you that have done it before, we've heard from you, and this is going to save you massive amounts of time and money, which I'm really excited about. Plus it makes you look super professional, right? I mean, when they call in the member services, this is a dedicated person that picks up 98% of the calls on the second ring. I mean, we're talking about, Amazon level customer service here, guys. We want to be at that level. That's what we're trying to deliver and help you as business owners, because you own your business. This is your business. These are your clients, and we want to make sure that you put your best foot forward. So learn about that program, learn about that AEP campaign, because I think there's massive value in it. The other thing that they launched is a quick little video, and there's no audio on this, so I'm just going to show you guys really quickly. This is the experience that your members have on their mobile devices So I am sharing my screen here. So your members, when they scan that QR code, or they click the link, you could see what it looks like. And he's going through it right here. I want to switch plans, or I need help with my current plan, or I need help with something else. They can leave feedback. Um, and then it asks them, let's go ahead and check your medications. And if you've already put in their meds and doctors, it's just going to review that information, right? Maybe it's missing that. Now there's a verification of date of birth for your member to lock in and make sure nobody can access their information. But look how awesome that is. You got Humalog in there. They can change it and say, no, I've actually changed that medication. I take it 4 times a month. And he's doing this really quick, but your members can also add medications if it's missing from that list, which is again integrated into your CRM system. So every year you don't have to ask them who, their drugs and which pharmacy they're going to. They're automatically putting it in your system for you. I mean, this is incredible stuff, right? And there he's searching for a doctor. This is actually linked into a company I believe called Vericred, which is probably best in class as far as providers, and making sure that the provider information is loaded and added in there. And hey, maybe we were missing the phone number, so member puts in their phone number. Maybe they moved, maybe they changed their shipping address, which he's showing here. And it's got a smart search on there, so just like Google, there it is. And this takes about 2 minutes or so. Maybe you're missing the Medicare ID number and the effective dates. Your member is giving you this information, so you don't have to ask them for it. Okay. And there it is. And then it's asking them at the end, what benefits are they interested in for this year? There's your survey. Once they complete the survey, it's done. And then it comes back to you and it says, hey, guess what? We'd like to make sure that you have this information, and you reach out to your member and you get those questions answered. So there it is. Very, very amazing stuff there from Spark and the team. And then Kelly was asking, is this in the gold key? And the answer is yes, absolutely. So let me take you back on how to get that. So in the gold key here, all the Spark information. Once you're in the gold key, under activities, Spark platform, click Spark platform there. And the first thing you got to do is watch that Spark webinar. Make sure that you fill in the terms and conditions, and you got to upload your book of business to take advantage of this, because they need to know where they're going to send those postcards, right? So you got to get that all done. There's the AEP campaign that I loaded right there. There's a video, so very quick to get to it. The video library is there. If you need member services, if you have any questions, or if you want to jump on a live session, they have open training sessions there. Or if you absolutely need a one-on-one with John Mullen, you can click his calendar, and he'll be able to help you with that. Okay. A couple other questions that we have. What's been Spark's experience with beneficiaries updating info on Spark? I think they will need help. Well, yes. And so, Elisa, what's happening is they have the ability to do it themselves, or they can just simply call the number at Spark, and then they'll do it for them. So it's really easy. If they can't do it online, they just call the number. Super easy. Okay. And it'll be on that postcard that you'll see. So you'll see the postcard before it launches. You have to approve it, and then it'll get launched. The cutoff for that, again, is September 12. September 12, mark your calendar. If you do not have your book of business uploaded by then, you will miss the AEP campaign. So there is a hard stop on September 12. Many of you have signed in, but you haven't got it done. So make sure you get that done. Will's asking if we populate this info into Spark, will it be populated into HPM Shop? That's a great question. Unfortunately, at this moment right now, it does not have an automatic integration. However, John and I are going to be working on how we're passing that information back and forth between systems. So we will have a Band-Aid solution as much as we can. So we'll have guidance on that. It's a great question, Will, and it's something that's top of mind for us now. Nick is asking, reminder, next Monday is Labor Day, call or no call. Thought you may want to mention it here. Thanks, Nick. Yes, no call next week. It is Labor Day. I hope everyone enjoys their Labor Day. That's enough out of me, right? One last thing before I turn it over to Rick, who is on Ring Central now. One last thing before I turn it over to him is we have we have split up the appointment tracker system. Okay. And many of you are asking, hey, CenterWell, I put in some members, dedicated, I put in some members. And what was happening is I'd have to chase you down and try to figure out which members you submitted, or they'd send you a check and you say, hey, these are all wrong. And then we go back and forth. There's a lot of auditing involved, right? So what we did is we created 2 dedicated forms. The dedicated one is already fixed and synced into their system. So every time that you put a dedicated member in, you're going to use the dedicated lead transfer form, which is in the gold key under PCP appointments. And it's right under their video. So you're going to click the dedicated link to put in dedicated patients, and then the CenterWell link to put in the CenterWell patients. I haven't yet linked that one to them, but every time that you put in a lead with dedicated now, it goes directly to the director. And so he's not going to have to chase you down. Okay. So whatever they've got should match in their system, and he's getting notified. So I'll keep you posted on that. Just want to make mention of that. That should speed up the process for payments and all that good stuff. So, all right. I've got Rick on the line. Rick, can you hear us? You might have to unmute yourself.
There I am. Yes, I can hear you.
There he is.
And no video. Yes, here I am.
There he is. There he is. All right. So, Rick, I made you a moderator too. So if you want to share anything, it's going to be at the bottom of that toolbox there. Very good. So again, real quick introduction to Rick. Rick is my buddy from Arizona, and we've been working together now a little over a year on the CleverRx. And CleverRx has expanded their portfolio, and he's here to tell you about all the cool tips and tricks that they've got going on. And I just thought it was the perfect time to kind of relaunch and tell you guys about CleverRx, Clever Health, because we're about to go into AEP, and you're going to bump into people that don't have Medicare or find ACA a little too expensive, or maybe even want to supplement their health insurance with their current coverage now. And so I'm not going to steal his thunder, but Rick Krug from Clever, take it away, buddy.
Thank you, Justin. Hey, it's great to see everybody. Well, actually, it's great to see all of your initials here. Hey, real quick, Justin, would you do me a favor?
Sure.
Whip out your Clever Health app and send the invite. Probably send it through chat. It's gonna be a little clunky, and here's why. That invite needs to go into their phone.
Okay.
So if there's a way to send it to everybody's phone or upload that into the phone, you'll see why in just a second.
Okay. But do you want the CleverRx or the Clever Health?
Clever Health. It's virtually the same, but go through the Clever Health side because it'll take them directly to that.
Got it.
Yeah.
Okay, give me a moment.
Hey, everybody, I don't know if I have had a chance to meet all of you. I will. I promise someday. I was out there, what was it, 8 months ago, something like that, maybe a little longer, and we did a little seminar on CleverRx, which is the prescription discount card that is national. It actually beats GoodRx about 75% of the time, and it's accepted everywhere. We have expanded to Clever Health, and this is amazing. This is a virtual online AI system for somebody who needs to see a doctor or needs to see get diagnosed for something. I'm going to walk you through this. And the first thing everybody says is, yeah, sure, if they need to see a doctor, they really should be seeing a human. Yes and no. As we already know, virtually and literally 80% of all ER visits could be handled over the phone. We already know that nationally. Yes, there are many. If you see a bone coming through your leg, you've got a broken leg, go to the ER. If you can't move, something's wrong, get somebody to get, there's reasons to go to an emergency room or an urgent care. This, for many people, will solve that. Now, emergency room costs are anywhere from $600 to $800 to $1,000, maybe more, sometimes less. Urgent care can be $125, $200, whatever it is. And the wait time alone in those will spur you on to this for your clients, for anybody else that needs this type of service. So let me just walk through what it is first. Then I'll take questions, excuse me, and I will tell you how you benefit from this, not just your people, but you personally. So everybody can see this. Does that, Justin, tell me, is that screen big enough
Yep.
for everybody?
Yeah, it's
Great.
perfect. Thanks, buddy.
All right. The beginning point, let me just walk through this, and it's going to be like probably learning a little bit of, I don't know, Western Civ, where you go back and say, I'm going to go bounce back and forth through history just to give you the overview first, and then I'm going to go back and get the details. But this is called Clever Health. It's an online access to healthcare through virtual reality and artificial intelligence that actually, we've studied this, we've worked with this. The guy that invented this is the guy that wrote the programs that made telemedicine possible. So this is his gig. He knows what he's doing with all of this. So it would start this way. This is the website for it. Most of this work is done on with your phone. Most of it's done with your phone, but you can go to the website and have the same experiences on your phone. So I'm going to show you from the website side first, and then show you how it works from the phone, making sure I'm not getting, okay, good. The first thing you do is download the app. The way you download the app is enter your phone number, but don't do that, please. Don't do that. We're going to go through Justin. He's going to give you the connection for it. And here's why. Nobody gets to join this as a wildcat or just somebody off the street. What's going to be asked for, if you went through it this way, it will ask you how you got this reference. Otherwise, it just takes you off into space, and it won't benefit you, the agent, just to hand it out like this. And I'll show you why. First off, 3 things this app will do. It's integrated with RX savings, prescription savings through CleverRx. It is a smart virtual care, and it has a mental health support component to it, which is really interesting to me, because a lot of people need just a short time refresher course on themselves, and this actually supplies that. So let me jump into what's going on with this. The benefit of this has been selected because it's faster to receive care, it's better for your health and your wallet, and it's easier to use. Now, that is clever, right?
Mm-hmm.
Here's the thing. We do know that the word nosocomial, if you know what that word means, nosocomial is a disease or a sickness that you get from a healthcare facility. A disease or sickness you get from a healthcare facility. Just going to the ER or going to the hospital or going to the urgent care exposes you to sick people. Golly, that's where they go, right? And it exposes you to all types of airborne problems, sometimes surface-borne problems, and that's the exposure. Nosocomial diseases account for virtually 40% of all diseases in America, and accounts for 60% of all hospital deaths come from an acquired disease that you get from being in a place where other sick people are. So we're breaking that down by simply not having to go to the ER or the urgent care. This app allows both the patient and the provider alike to access higher efficiency, engage more frequently, and interact with a better user experience. And this is what it looks like. This is what the app will look like. It gives you all types of possible issues you may have. And is that too small there, Justin?
No, it's perfect.
Okay, good. So let me walk you through it. It uses a virtual reality that has been tested, and it takes that virtual reality information and it gives it to a physician. There is a physician that engages with this with the patient. And here's the amazing part. What would you say is the average wait in an ER, Justin? Get to the ER, average wait.
Oh, my experience, probably about 3 hours.
Yeah. 3.5 to 4 hours is the average wait. Yes, sometimes if you go in there and you say, my heart, I'm having a heart, they'll put you right in. I get that. But for most issues, I've got a cough, I've got a fever, I've got this problem, it's 3 to 4 hours, right? The average wait in an urgent care is substantially less. It's 2 hours. So it's 1/3 the wait of an ER. This entire system, the average time from the time you start to the time you get a diagnosis is 6.5 minutes. That's it. So it looks like this. We integrate the prescription intelligence that's powered by CleverRx along with this. And I will tell you this is not a drug pushing application at all. In fact, We used this. My wife used this about 3 weeks ago. She'd had this cough, and sinus pain, and she thought she had a sinus infection. She went through the whole steps, and it diagnosed her accurately, because we did actually go to a doctor and say, okay, I got to find out if this is true. We went to the doctor, and it diagnosed her with viral sinusitis. In other words, a viral sinus infection. As you know, viruses are not treated with antibiotics. So it did not recommend any antibiotics, but it did recommend things like Tylenol or Advil, lots of water, drink, rest, hot compresses on the face, all kinds of things to go that take you to a healthier feeling. And most sinus infections, not all, most sinus infections are just major irritations, but they're not. You're not laying down in your bed for 5 days. Some people get those really bad, but most of them are just like you feel like you got a cold and you want to stay away from other people, but you're not like totally incapacitated. That was her, and it and it gave her ideas and recommendations, but it came from a physician, not just from the artificial intelligence. So every time there's an interaction, there's a base of physicians waiting for these calls. They read the AI, they read all of the information, and they make a diagnosis. And this is what they do. They're online physicians. They're not sitting in a foreign country somewhere. They're in America, actually making this diagnosis for people that they know the culture of. They know what's going on. We know where they're, like if it's in California or New York or Florida or any place else, they have the information on the basic environment there, those kind of things that would give them a better understanding of how to make a better diagnosis. So it also has an intuitive mental health chatbot that gives you feedback. It's AI powered. It specializes in anxiety and depression, which is like 95% of all mental health issues that come across, as in acute, short term, something going on right now. It's 100% anonymous. Your names, any identification is totally protected. And it also has that ability in there to say, we believe that you need to see a professional, because if somebody gets on this bot and says, I feel like I'm going to kill myself, which happens, this does not try to talk them out of it, because it is artificial intelligence, but it recommends seeing somebody immediately. It recommends calling 911 if necessary, that kind of thing. But for a lot of it, it's just responding, just like you and I would do if we're feeling down. People have found this thing to be helpful for getting through a mood time, and it's available right there all the time for them. Here's the proof in the numbers. The average time from initiated start questionnaire to the provider completion of the consult is 6 minutes, 44 seconds. I mean, this right now, you're already saving time. 40% of the prescriptions are $10 or less, because most of these prescriptions obviously are for what you would call lower grade type of issues. You have a fever for a couple of days, you're coughing, got a lot of snotty nose, the whole thing. You probably have a cold. You probably have this, you probably have that. There's all kinds of things you can have. If you put in there in your questionnaire, I've had this dry cough for 6 months. Okay, that's an indicator of something much more serious than would happen with this. Probably not a prescription going to be given. Probably a recommendation to see a medical professional as soon as possible, because you're talking about some, I picked one, obviously, something that's going to indicate something's wrong with the lung function that could be much more serious than a cough, a cold. Here in the Valley in Phoenix, we have what's called valley fever. If you get valley fever, that can not only be debilitating for life, it can be deadly. And so, and having a long-term dry cough is one of the symptoms of valley fever. So it will tell you to move on to a higher level of care. 80% savings when compared with traditional telehealth plans. A lot of the plans on telemedicine and these type of AI plans, you're paying like what, $40 a month. What is it, Justin? $30 a month, $15 a month, a subscription rate, correct?
Yeah, something like that. Mm-hmm.
This is per visit, period. That's
So there's no monthly cost for this.
No monthly cost to this. No monthly fee on it at all. It is per visit at all. It is anywhere from $25 to $30, depending on where it is in the country. And that's it. It's not 25 to 125. It's 25 or 30. Those are the two price points, and it just depends on whether it's in a high metro area where there's high levels of calls, or in much more rural areas. So go ahead.
So they only pay when they need to use it.
They only pay when they need to use it.
When they need
you
to
get
use
on the
it.
app. And here's the thing: you only pay for the diagnosis. They'll go through the questionnaire. They'll go through all the kinds of things, and then it'll say, "We have a diagnosis. Please put your credit card in here."
Got it. And that's cheaper than a lot of copays.
Oh yeah. $30 if that's the top one. $30. That's it, and you get a diagnosis. You get a prescription. Right?
Yeah.
If you need a prescription, you get the prescription right there. It is written. You take that prescription in, and you can print it, or you could take it in, and it's accepted at the pharmacies. So
our buddy Stan is asking, is this available in all states? So for
every state,
awesome.
Every state, 80,000 pharmacies. You probably will not find a pharmacy that unless it's one of these boutique pharmacies where if you're taking 6 drugs, they will put them all in one massive pill for you.
Mm-hmm.
Or you have, there's people that take a large amount of drugs, and they will, instead of all the fillers that come in the pharmaceutical side of it, they'll take just the drug itself, which many times is a little tiny bit, and all the fillers make it so that you can actually down that stuff. Mm-hmm. They'll take all of those drugs, they'll put them in one capsule. Mm-hmm. And they're expensive, super expensive, but they'll do that for you. A lot of people, and it's just the boutique kind of ones. That many of those don't take any prescription discount because they don't have to. Right, you're going there for that specific service, and you're self-pay almost every time. In fact, they hardly ever take insurance for that reason. So
here's a good question from Eva. My friend Eva is asking, do they check legal status? Because we do have some folks that just moved here, or
they check no status. This is completely anonymous from top to bottom. There's no status. And you say, well, it's not anonymous. You got to put your phone number in, things like that. There is no check on any of this. The only reason your phone number goes in is so that you can get it on your phone.
Right.
So if Verizon or Alltech or whoever else you use out there is checking statuses, well, and they're not. No, they're not. Yeah. So we really do want to help all humans, whether, no matter what their status is, no matter what their place in society is, no matter what their income, race, creed, color, choice of any choices. We want to help humans. So there's no background checks. There's no report. We do no reporting. We are completely bound by HIPAA, and HIPAA binds that as well. So that's a great question, especially in border states, where there's a lot of immigration and a lot of need for helping these people in a way that they feel safe, and make sure it happens that way. So the drug savings happen just like it did with CleverRx. If you're familiar with that, you put the drug name in and the zip code. The reason you put the zip code in is not to track you. The reason you put the zip code in is because different prescriptions have different prices nationally. It's bizarre. They have different prices in each pharmacy. And I've seen it happen, by the way. We work with all the pharmacies, not the pharmaceutical companies, not the creator of the drugs, but the seller of the drugs, right? We work with them, and it is literally a daily bidding war for pricing. I mean, it's daily. It starts it ends at 6 a.m. Central Standard Time. Ends at 6 a.m. That's the price for the day. At night, sometime in the night, there's this bidding war that goes with 80,000 drugs, and it's all done, through computers and the whole thing. And the drug prices. So CVS, who is the highest in America, will come up with the drug. Walgreens will come with the drug. Publix will come up, not the drug, the price. Publix will come with the price. Walmart, all the way down, and those are the prices for the 24-hour period. Right. Got it. And CVS is almost always the highest, not every time, but almost always the highest. And then you have Walmart, Walgreens. Walgreens is second highest usually. Publix gets down there, and some of these other places, and the prices go down as they go through the different providers. The pharmacies. Let me show you. Yeah, go ahead.
Yeah. So we're almost at time here, but
I'm sorry. Can I just real quick run through how the
go
app?
for it.
Yeah,
Go for
you
it.
download the app, right? You download Clever Health. You enter your data, and again, make sure you let Justin send you the invite. Don't do it from outside. Do it through Justin. You get started. Your last name, date of birth, zip code. Again, it has not tracking. It's just they have to for HIPAA reasons. They have to have that information. You start using this, it starts asking you questions like, what are you looking for? Virtual care, prescription pricing, mental health, chatbot. And it goes through, is it women's health? Is it respiratory? Is it eye, ear, nose, throat? Is it skin? What is your particular issue? And then we always encourage everybody, once you have this, you can share it. And the way you share it literally is you text that information to someone else. And when you do, they will open it up and do the exact same thing you did. And it only charges you if there's it charges you when there's a diagnosis, and you go through the entire questionnaire from top to bottom. And you all, when you do this, since you're agents, if you give this out to your clients, anybody else, you get paid $1.
There it is.
Anytime this is used, you get paid $1. If they have 10 prescriptions, you get $10. If they just show up and get a diagnosis and there's nothing else that needs to be done, no prescription, you get $1. If they use the chatbot, you get $1. If they use this and 10 prescriptions, you get $11.
Awesome.
Right? And it's and again, this is just a level for people, like you said, that have that. There's a donut hole place in all kinds of life, right? Mm-hmm. And this is one of those. So I'm sorry to take up so much more of your time.
No.
But this is exciting because this is an answer for people who just can't get to the ER, don't have the money for the urgent care straight across the board. Any questions, fire away, and I'll try to go as fast as I can here, Justin.
Yeah, no problem. So Eva was asking, how do they pay? Is a bill sent to them? And I'm assuming that's through the credit card. They've got to enter the credit card.
They've got to do, they've got a credit or ATM or something. It has to be paid as used. Yeah.
Okay, through the app. So they've got to enter in some kind of payment. Got it.
Yeah.
Okay.
Which is again not tracked.
Yeah, exactly. So I sent my link via the app there, Rick, and it's in the chat. So that's the link that they'll use to sign up.
Yeah, if they can copy and paste it into their phone somehow. I know this is a little clunky, but yeah.
Well, just guys, just shoot me an email or something if you can't figure it out, and we'll get you set up with it.
Yeah.
Between Rick and myself, I'll loop him in and we'll get it set up.
Yeah.
Absolutely. So another vehicle for income guys, another solution for your members. For those folks that might need a little bit more TLC, or those folks that don't have health insurance and are choosing not to have health insurance. They're out there, say, hey, look, at least, if something really bad happens, download this app, send them the link. And if they use it, you get paid $1 times all the different services that they use. And, there's stories, Rick shared a story of a guy that's like clearing, wow, I don't even remember how much money.
15 grand a month.
15 grand a month,
And all he does is have doctors hand this stuff out.
Yeah, exactly. So this could be a tool to deliver to your doctors and say, hey, look, doc, for your really, really high risk members, maybe offer this to them because you don't want them going to the ER at Friday night while you're at dinner. This is a service that might prevent some ER visits and some urgent care visits, and that's worth a lot of money for a doctor. So you become a hero, and hopefully that, translates into leads for you.
Too,
yeah, exactly. Everybody looks good in that situation. So awesome stuff, Rick. Thank you very much. I know you did a crash course here too. I know Clever Health is doing some webinars, or they did some webinars, so I'll make sure to get that information out to everybody as well.
And you know what? You can have them call me too. You can have my phone. You put my phone number in the chat there. Call me
Yeah.
anytime. I always make sure, if anybody calls me, I always make sure, all right, who you working with? And your answer is going to be Justin, right?
Yeah.
Because I
Yeah.
work directly with the company. I'm not a independent sales guy out there just trying to this is my gig, and I work directly with the company and directly with people like Justin and others. It's not multi-level marketing. We're not trying to,
Right.
there's no, by the way, it doesn't cost you a thing to get into this. It's not, you're not going to get oh, by the way, it's $400 initiation fee or anything like that. No, this really is, it's as good as it looks.
Yeah, Larry says the download went well, so he already clicked the link. That's
Right
working.
on.
Awesome. And then Rick, I'm going to put your 928 number, the
Yes.
6268. Okay.
Yeah.
So that's his phone number there, and then which email do you want to use?
Rick at CleverRx.com.
Rick at CleverRx.com, and
Yep.
I'm putting that in the chat there too, guys. So in case you have any questions for Rick, just mention that, hey, you're working with HPM, and he'll get you set up. And the team here is here to help as well. So awesome stuff, man. This is like a secret weapon here. I don't think anybody else has this. So
Oh yeah.
really excited to share that with the team.
I can't wait to hear how this goes.
Yeah. Me too. Great stories, guys. So we're at the top of the hour. Rick, thank you very much for your time
Thank
today.
you.
And we'll do more of these. I really appreciate it. Everyone, thank you very much for being on the call as well. I hope everyone has a fantastic week. Please remember that the month closes on Wednesday. Get those apps in. Thursday is the 1st. No call next Monday. It's Labor Day. No call next Monday. Enjoy your long weekend. All right. Take care, everybody. Have a fantastic
Bye-bye.
week.